We're going to have a whole series of videos on the alphabet soup associated with care. CMS, Center for Medicare and Medicaid Services, CAPS, HOS, MA, Medicare Advantage. I'm not going to even tell you what some of these are right now. I will tell you what they are. I'm not going to give you the full names on the acronym. CAPS, I'm not going to tell you what it stands for. I'm going to tell you what it is. It's a patient experience survey. It's triple weighted right now, by the way. So you've got to make sure that you've got a really good patient experience. HOS is a patient knowledge of their medical conditions. Also triple weighted and also critical to preventive medicine or population-based medicine, especially when you consider that it's more important what the patient does between visits to you, as in every time they eat. That's the most critical health behavior they can have. So HOS is critical. It's a way of judging what the patient understands about their health status. But again, that's CCM, chronic care management, a new program which is turning even fee-for-service or straight into preventive services, population health, fee-for-value. So as you know, you can die in a blizzard of alphabet soup when you're working with Medicare and other government agencies. But this is going to be real simple, real 101 ABCs. You know, most doctors don't even understand the basics, and that is Part A, Part B, Part C, and Part D of Medicare. Part A covers inpatient hospital stays, skilled nursing facilities, SNFs, some home health visits, and hospice care. Part B covers the outpatient physician services, outpatient, preventive, and some home health. But again, Part B is also known as straight Medicare, because there's plenty of outpatient done outside of Part B in Part C. Part C is the Medicare Advantage program. These days, 48% of patients are involved, of Medicare patients are involved in Medicare Advantage. The other 52% are involved in straight Medicare. They are healthier. They end up requiring less hospitalization, fewer procedures, and they're happier. And they cost Medicare about 12% less than a typical straight Medicare patient. You ever considered what 12% of the Medicare budget would be? It's huge. And again, it's reflecting better care and better health. So that's what needs to happen. Part D, you know that. It covers outpatient prescription drugs through private plans that contract with Medicare. Now you can get, there's always a little bit of change here, exceptions there. This drugs thing, you can also get coverage for drugs in Part C or the Medicare Advantage program. Now, let's just repeat that, do some visuals, come in at a very high level. Part A, hospital coverage. Part B, straight Medicare or outpatient Medicare, except for the Medicare Advantage programs, which are Part C. Part D is prescription coverage. Medicare Advantage, Part C, more detail on what you need to know here. It has an annual out-of-pocket maximum. It can include prescriptions, as we mentioned. It often covers things like dental, vision, hearing, and other benefits which usually aren't covered in your routine insurance. Fitness programs like Silver Sneakers, I think, is covered for everybody in Medicare now. Unfortunately, most people don't know it. So you can go to your Y, like I do now, for free. At least covered under your Medicare program. Coverage is provided through private insurance on Part C or Medicare Advantage, like Humana, Cigna. These companies have Medicare Part C coverage. And it usually comes with a network. Some of them are very broad networks. Many of them are not. There are Medicare enrollment periods, typically October through at the end of the year. So thank you for your interest. Remember, preventive medicine, population-based medicine, value-based care. These things are continuing to show the patients are healthier. They don't need other drugs and hospitalizations when they're healthier. Don't they deserve that? And guess what? You have more free time when you're the physician providing this care, and you make more money. Don't you deserve that? Get you and your patient off the treadmill. Thank you for your interest.